I think the challenges that we're facing right now related to coronavirus are leading to a lot of anxieties for people. And one of the key distinctions to me is what's the difference between a healthy and an unhealthy anxiety. Healthy anxieties are things that keep us safe. It's why we prepare for exams. It's why we don't do things that are dangerous, like go swimming with alligators. However, unhealthy anxiety can be a healthy anxiety that's gone too far. So, for example, with following the CDC recommendations of washing your hands for 20 seconds, people started washing their hands for 30 seconds, 40 seconds, a minute, 2 minutes. Taking showers that are really long, those are examples of a healthy anxiety that can go too far. But then there are also the unhealthy anxieties of like, so I'm going to completely isolate myself from somebody that I'm living with when I have absolutely no symptoms and I haven't been exposed.
During this time, it can be really difficult to identify whether or not our own anxiety is turning over to unhelpful anxiety, and especially other people, including our children. So some really easy ways to identify whether or not the people around you are experiencing that unhealthy anxiety is to identify whether or not they're still engaging in the practices that they would do each day. So for example, if you have a child and you know that every day they love going outside and playing baseball, and now every day when you're like, hey, do you want to go outside? They're like, no, what if I get the coronavirus, or what if I get sick, or what if I get germs from the bat? Identifying that, like, wow, that's a really good way to see that they're no longer engaging in things that they normally would. And that translates over to adults as well. So if you have a friend who loves going bike riding and they've identified that's something they value, and you notice they're no longer doing it anymore, right, and it's starting to kind of impact their daily functioning, being willing to talk with them and asking how they're doing and whether or not they would like to seek help for their anxiety they're feeling. So there's a lot of resources that people who are feeling heightened anxiety can locate. So some really tangible ones are, there are a lot of really great apps on your phone that increase like mindfulness, or even things as like deep breathing, which we refer to a lot as belly breathing. So taking those really deep breaths through your belly, which can be great for adults and kids. And some other great resources are on our website, which is the Center for OCD and Anxiety-Related Disorders. We also highly encourage people, if you're feeling down or would like someone to talk to reach out to Alachua County Crisis Center. I know a lot of times people think that crisis line is only for people who are feeling suicidal. However, that's a great resource for people who just need to talk to someone as well.